Since 2001, Access Healthcare has provided care coordination to people in the Twin Cities metro area who are living with disability and complex medical conditions. But medical conditions are only part of the many challenges people with disabilities face. Psychosocial and socioeconomic factors prevent many persons with disabilities from successfully navigating confusing healthcare and social service systems by themselves. As a result, they experience an overall decline in their health and safety, frequent visits to emergency rooms, and multiple hospital admissions. This revolving door system of care unleashes an emotional burden on the person and a financial strain on the healthcare system overall. Access Healthcare uses a targeted approach to identify persons with disability who are most at risk. Access Care coordinators then partner with these members to develop a person-centered plan that is tailor-made and integrates medical treatment, social services, caregivers, and community support to reduce their risk of declining health and hospitalization.
As Access Care coordinators, we really take a holistic approach and look at the whole situation of the patient. I think Derek's case and situation is really ideal for care coordination. He has serious illness and he works with numerous providers. And as a care coordinator, I walk alongside of Derek to make sure that he has all of the information and all of the care and resources that he needs to stay out of the hospital and to manage his complicated health issues. It's like a bicycle wheel, and Derek and I are in the middle of that wheel. And frequently, of course, the primary care provider is in the middle of that wheel also. And all of the specialists, in Derek's case, a pulmonologist, a hepatologist, a rehabilitation therapist, behavioral health counseling, all of those specialists are on the outside of the wheel. And what we do is we access all of those resources together, and we make sure that communication between all of those resources is happening, and that Derek is clear on the expectation of all of those resources. And we tap them and work with them to make sure that Derek, one, stays out of the hospital and is not readmitted, and two, that he reaches his long-term health goals.
The long-term goals of each member are different, and care coordinators work with each member to develop a plan that will help them achieve their goals incrementally and live a healthier and independent life. But there is one common denominator in every plan. The long-term goals always belong to the member.
I am here to help her achieve her goals. It's not about what I want, it's not about what anybody else wants, it's about what she wants for her life. Doris has been a long-time member of Access, and she had herself into a situation that was not necessarily healthy. The team of people that worked with her were very concerned that her needs were not being met at home. Doris was very resistant to change this because she felt like her only other option was to be in a nursing home and that she would be alone for the rest of her life. She didn't want to be alone. One day she decided she was done, and she said, "I'm not going back there."
I stopped seeing my ex, and I was with him for 38 years. And I decided that it was time for me to live, not die.
So we jumped on that. We got her alternative housing and got her moved without anybody being able to persuade her not to make that decision, while reminding her the whole time it was her decision. And she stuck with it and did what she needed to do and has been thriving ever since.
I have a terrific team on my side. They are wonderful. I have a 24-hour nursing I've never had before. They always seem to know what's wrong with me. They catch it and they know who to talk to and who to call.
A key component in empowering members to achieve their goals is developing a relationship between members and their coordinators.
I think the key challenge with Derek and with many of our members is a mistrust for healthcare. And it's really important, and it's time consuming. That's the challenge is I need to develop a relationship with Derek and my other members. I can't just step in and suggest they do something to improve their health. I need to have credibility, and that credibility comes from building a relationship and from not pushing and from not moving too fast, but letting them know that you will be there, you're an advocate for them, you're there for the long haul. We are their advocate.
No.
I just grabbed her phone.
Ever since she became my case manager, she has really been a motivation for me, because she's always giving me that positive feedback that you can do it. Don't give up on yourself. You have people that care about you, and if I need her, she's there, because a lot of the questions that I don't ask when I go to the doctor or for a checkup, she asks. And I'd be amazed because I wouldn't even think of these questions, but she'll ask and we'll get a result. So that let me know that she really cared.
Members receiving support from Access benefit in many ways. Their overall health often improves. They spend less time in hospitals and emergency rooms, and they gain access to services they need to help keep them in the community, such as housing arrangements and other community-based social services. But perhaps their greatest takeaway is renewed hope and focus in achieving their goals.
I already want to go back to work. I definitely want to coach. They're the main two things. Being able to walk, being able to go fishing, being able just to do things without the oxygen tank. Again, be my normal self. Just want to have a successful surgery and doing the right thing. I'm not ready to go nowhere yet. I got a long life ahead of me.
I feel much more secure that I have wonderful care coordination that helps me. They don't take over my life, but they help me try to improve my life. You have helped give me my life back.